quick slides, it's discussion too, so just keep talking. When I talk too much, I start to cough, so just bear with me for a minute. So, pressure injuries, how would you define, and you can read the slides if you need to, a stage 1 and a stage 2, how would you define the difference between the two?
Broken skin would be the difference.
Okay.
Stage 1 is just redness.
Mm-hmm.
Non-blenching.
Yeah,
Non-blenching.
Yep,
And 2, there's actual skin breakdown.
okay. And then how would you distinguish a 3 or a 4 from each other?
4's all the way to the bone.
Yeah, bone
Bone
or
muscle.
muscle tissue close, yeah.
Yep. So, looking at the pictures at the top, so that first, like, this first top one, I know the pictures aren't perfect, but what would you say that top one looks like it would be?
1,
One, body heals.
And the one right next to it?
1.
Unstageable.
Unstageable. Oh yeah, because of the darkness, you can't tell if there's damage under the skin.
Well,
It's a depression.
that's purple.
Ah.
Yep.
If it's purple, it's a D.
It's a
Yeah.
Oh, DTI.
Yep. So this one.
Ew. This is
That's a bad stage.
Yeah.
Stage
That's where you
5.
see the
Yeah.
spine and carrying on all that.
and everything else.
We can't see what's underneath the black.
Yeah.
Yeah.
It's necrotic tissue.
Then it's unstageable.
It's unstageable. Yep. So it could be, we don't know.
Yeah.
And, we can't tell. So,
Is that the bottom?
yeah, that one.
Is the one next to a bottom? No, down.
Oh, that one?
Yeah,
What would you think that would be?
it looked like a bottom. It looked like.
Oh, I don't know. Yeah, it looks like it's a bottom. So,
It's a 4.
It looks like
It's
a
4.
4.
What,
That's a 4.
come out that last one?
okay. And then, well, it's hard to tell if this picture, if this is
Yeah.
bone or if this is like slough.
Slow.
So if there's slough, what would you say something?
3.
Unstageable, because you can't tell.
Oh,
Good
good
answer.
job, Allie.
Yep.
Because you can't see the wound.
You can't see, yeah.
You don't know what that structure
So
is.
what would that be?
2.
That's slough.
Oh, that's
Unstageable.
Yep,
Unstageable.
yep, because you can't see underneath, yep. Now this one, that's kind of good for me to see too, actually. It looks better on this than it does up on that picture.
What is that?
I know, I can't.
I don't know if I can tell.
I can't tell it.
I can't tell that one very
If it's
well.
bone, sin, then it's 4, otherwise it's 3.
Okay, yeah, I can't, that one's hard to see, I guys think.
Yeah.
So what about blisters?
Oh.
What do you think blisters are? What would you stage a blister as?
Yes. If it's from a burn, then you would think too, because that the blister is like that damage to that portion of the skin, but you also can't see, so unstageable.
Okay. DTI? When you look at more as a DTI or stage 2?
Well, if it's clear fluid, that's the distinguishing characteristic.
Okay.
If it's clear, it's a stage 2. It's a purple or red blood filled, and that's the definition of tissue pressure.
Yeah.
Kind of,
So in this
Yeah.
case, it would be what, stage 2?
yeah.
Yeah.
That looks like stage 2.
So would you ever open a blister?
No.
No,
No.
No one
Why
wants
does
to.
everybody want to pop those? I don't get it.
Because we like to I know.
Well, it's kind of like watching pimple popper. There's just
I
something
know,
about
it is.
watching
No,
it,
that's how I know you're kind of like, I know I can't.
but you don't because it's a risk for infection, and in most cases, it increases the pain.
It doesn't protect the skin.
Mhm.
Okay, now DTIs. Now this is probably the most common one we see in hospitals, honestly. At least here, I would say. We see a lot of DTIs. What skin, what ethnicity is harder to discover a DTI on, or hard to see?
African American.
What color, what would it look like on an African American patient?
It would, well, it still looks purplish, but it's, I mean, purplish. I don't know how to describe it.
Maybe blue,
Yeah, like, yeah, maybe more
a
towards
little
blue.
darker. It's gonna depend
Yeah.
on their color,
Yeah.
how dark they are too. But a good way to do that is just to look in those high risk areas on all of our patients, especially them, to see if there's just any kind of discoloration. And if you weren't sure, what would you do?
Wound consult.
Or phone a friend.
Phone.
Yeah, your skin champion, skin champions on your
That's
unit.
right.
Wound team
Yep.
is my friend.
Yes, yes, that's true, they are, yes. What are ways that deep tissue injuries are caused?
What are all the ways they can be caused? I mean,
Device
sometimes,
related.
yeah, devices or,
Mhm.
It can also be from pressure.
or trauma.
Mhm.
I had one that like
Well, trauma
person
would
took
be
a
a,
fall.
trauma would be a bruise, that'd be a different type of thing rather than pressure.
Well, yeah.
When you say
Yeah,
deep tissue
trauma's-
pressure injury, you're saying that the pressure over the bony prominence or device where it's putting pressure is actually shut off the blood supply and cause that tissue to die from the blood supply.
If your patient's heels are like that in the bed.
Yeah.
What about like sliding people up and down the bed a lot?
Shear.
My damage.
Shear or tears, then I would think the tissue.
Just ways that. Anything you wanna add?
No, I totally agree, yeah, no,
Okay.
yeah, so when you pull somebody up, I mean, that can cause like a friction injury. So sometimes you'll see that some kind of obscure skin loss or something that's probably not having wet skin and then pulling up, so carrier pace, protection stuff.
What do we call a wound team for a deep tissue injury?
Yes, yes, please.
So, how often do you see this on patients?
Oh, yeah.
More than we'd like to admit.
Sure, yep. So what causes that?
Leaving the prima fis,
They can, yep.
letting them sit in incontinence.
Yep.
Mollis, wet mollis.
Yes. Would
Not
you,
being bathed in general.
Yeah.
would you put a molly on and then put mesh panties over it?
No. Not unless they are mobile and going to the bathroom and they're more using it to catch like dribbling.
Yeah, perfect answer, yes. Yes.
Good answer.
What are ways we can prevent this?
Very green.
Keep them dry.
Dry,
Barrier cream.
Would we wait till they're red to use barrier cream?
Oh, no.
How often do you use barrier cream?
After
I
that.
think that every night after that, after the
Yeah.
bathroom.
That's a good answer, twice a day, and then anytime.
When you clean the
I'm
patient.
sorry.
No,
Throw it
no,
in
it's
the
right.
patient.
Do you want a real thick layer of it on?
No.
No, you don't need that much.
So if it's still, I mean, you could like when I think about putting a toothpaste on a toothbrush, like that's probably about the amount you need. Cause it just needs a fine thin layer. And it's gonna repel water for a while, like even when you wipe and clean off someone, you're still gonna have it on there. So it might be as needed, but yeah, you're right, a few times a day maybe, but you don't need to like glop it every time.
Yeah.
Just depending on, what you're cleaning up. Okay, what's the best way to prevent pressure injuries?
Turn
Yes. How often do you turn patients?
2 hours.
What if a patient refuses to be turned?
If they're confused, try to reorientate, educate. If they're not confused, educate.
If they're confused and refusing, would you just turn them
Reorient and
Yeah.
try to
You
turn.
try.
Yeah.
Because they don't know what you can't educate someone who doesn't know.
Yeah.
Yeah.
If they
You
refuse
do.
their meds, would you give them
If they're confused, you try.
We
Yeah.
educate,
Mhm.
yeah. We try to be educated.
If you, even if for you to do just like a little micro turn, just to at least
Mhm.
turn something if you can't like, because they're fighting or kicking or hitting you or swearing at you. Okay.
See, the buttocks are freely floating.
Yeah, What's the degree of turn you really want to try to get your patients off of at what angle?
30
Yep.
degrees.
What position do you really not really want your patient to be in when you're preventing injury?
Like the upright sitting.
His back.
Good.
Back.
Why? Why would
Because all your weight's going into that area.
perfect?
You know, I wonder, can we get that taken off of the MAR?
What?
Just out of curiosity, back,
Oh,
because that's all I've been seeing. Just curiosity question. Raise the issue.
What's on your mark?
Even on the inserter, the ability to
Left,
chart
right, back.
position on their back.
My flow sheet
Right.
right here.
Some patients have to be on their back depending on their surgery, but we usually don't see those here. I'm just saying, like in Cerner, that's probably why.
I guess probably that's why.
Like
I'm
I've
trying.
never seen what you're talking about. I have no clue.
Like
Because
it's
I tried
the
it.
left, right, and back like option.
When you chart
And you
your turn,
turn.
your ADLs underneath my flow sheet.
Okay.
anything else you want to add to this one? Okay.
I love that picture.
So what do we use these blocks for?
To help us remember what to
Sure.
turn them when
It's
start.
still every 2 hours.
Mm-hmm. Okay. So what time is it right now?
12:37.
What side should all the patients be on?
Their weight.
How would you document that?
In Cerner,
Which,
it'll say which
Mhm.
way you turn them and
Would you put anything on the patient's door?
yeah, you could put the,
Could you
The
turn
way,
and what time? I think we have on the door.
yeah.
Yeah, because it's already on the
Just
thing,
mark
yeah.
it, make sure patient is
Mhm.
turned
So these clocks,
appropriately and the project time.
they're on
inside.
that door. I don't know what you want to call them, but the
Yeah.
like little white sheet. And this clock is on there with little boxes for each time. So once you've turned them at that time, you can just check them off. And then if your patient was on their right side, what side would the pillows be on?
Could be on the left.
So it's always the direction that you're heading towards.
Mhm.
Not coming from.
So, do you see the difference between what the correct charting looks like and what the incorrect charting looks like?
The middle one, it all says right,
Mm-hmm.
and then the one on the far right just says complete.
Right.
Doesn't specify which direction.
Right. And I think Cerner doesn't help us sometimes in this area, because it's like, are we charting what they're capable of doing, what we did to them, or where they, you know, like, I think that's kinda all over. Depending how you were trained or taught or whatever, but it should be like, at this moment, right now, what is the patient doing? So,
And this charting was all found on the same patient, just so you guys know. So all three forms.
we just had a one upstairs, a pretty bad one, and it probably went almost 2 days for cut and paste of the same exact skin tear, which it was not. It was at stage 3, I can't, I haven't gone that deep into the helmet hand.
Last one I found was the AAU, the
Yeah.
tissue pressure injury.
Yeah.
So we found on 3B.
So cutting and pasting, don't cut and paste, or if you're gonna do it, then edit it to match what you're seeing. This patient probably went at least 2 weeks, many different nurses saw this patient, and it was the exact same documentation for weeks.
All right.